You raise your eyebrows, wrinkle your forehead, smile with your teeth up, frown, and puff at your cheeks. Okay, cranial nerve 7 is intact. And then I'm going to look at your mouth. So your mouth is pink, it's symmetrical, it's smooth in textures, and you can open up your mouth for me. Okay, dentures are all intact. I see good hygiene with the teeth. Mucosa is pink and smooth. Your tongue has papillae and it's pink. Looking at your uvula, can you say ah? Ah. It rises and falls into midline. And I'm gonna look at your tonsils. I'll give it a +1. Next, I'll be assessing your eyes. So conjunctiva is clear, sclera is white. I see no drainage. I'm going to test for 6 cardinal fields of gaze. So follow my finger, but don't move your head. Okay, I see no nystagmus. And then I'm going to test your pupils. So I'll just look over my shoulder. Okay, and then I want you to look something far away and then to me. Okay, so pupils are round, equal to light, and accommodating to light. Okay. Next, I'll be assessing for your heart sounds. Okay. So I'll be listening with my stethoscope. First, I'll be listening to aortic. Okay, S2 is louder than S1, and then pulmonic. S2 louder than S1, and then Erb's point. S2 and S1 is equal, and then I will listen to tricuspid. S1 louder than S2, and then mitral. S1 louder than S2, okay? I heard no extra heart sounds, no murmurs. Then I'll be inspecting your upper extremities. So your skin is equal in color. I see no erythema, no lesions, no bruising. I'm going to palpate. Any tenderness or pain? No. Okay. It's warm and dry to the touch, assessing for edema. None noted. And then I'm going to assess for cap refills. Okay, less than 2 seconds. And then I'm going to assess for radial pulse. 2 plus bilaterally. Same thing with the lower extremities, so go over here. Let me turn this way for me. Okay, so again, in lower extremities, skin is equal. I see no bruising, no lesions, no scarrings. I'm going to palpate down. Any pain? No. Okay, no pain, no tenderness. It's warm and dry to touch. I'm going to assess for edema and the tibial plate. None noted. And then I'll assess for cap refills. Less than 2 seconds. Then I'll assess for dorsalis pedis pulse. I'll give it 2 plus. Okay, forming hand hygiene. Next, I'll be listening to your lung sounds. First in the front. So the first 2 is bronchial, the next 2 is bronchosvesicular, and the last 2 is vesicular. So when you feel the stethoscope, I just want you to take a deep breath in. long sounds are clear. I hear no crackles or wheezes. I'm going to do the same thing, but in your backside. So can you scoot backwards for me? So the first two is vesicular, then the next two is bronchofesicular, and the last four is vesicular. And last one. Okay, same thing, long sounds are clear, and no wheezes or crackles. And next I'll be inspecting your abdomen. So can you lay down for me? I'm a little ticklish. Okay, so abdomen is, the skin color is smooth and round. So right here is the umbilicus, and that's the midline, and you have your right upper quadrant, left upper quadrant, left lower, right lower. So I'll be listening to your abdomen sounds. If I don't hear any bowel sounds, then I'll listen to each quadrant 5 more minutes. Okay, bowel sounds are no more active, and then I will palpate first, starting with light. Do you feel any pain? Okay, no pain, no tenderness. Then I will go again, but this time deep. Any pain?
No.
Okay, no pain, no tenderness. I feel no masses. Okay, you can sit up for me. And then I'll percuss your back for cerebrovestibular angle tenderness. Did that hurt?
No.
Okay, no signs of kidney stones. And then lastly, I'm going to assess for your range of motion. So can you stand up for me? Okay, just copy what I do. So can you extend, flex, adduct, internal rotation, external rotation? Can you flex, extend? Can you flex, extend, and then abduct? Okay, full range of motion in upper extremities. I'm going to test for your strength. So can you pull me in? Can you push me? Can you do this? Can you pull my hand out? In, and then up.
Like this?
Do like this. Okay, up, and then down. And then can you abduct your fingers? And don't let me bring your fingers together. Okay, and then can you squeeze my hand? Okay, it's 5 out of 5 for muscle strength in upper extremities. Now for lower extremities, can you flex, extend, just this way, flex, extend, can you abduct, can you internal rotate, external, external, and can you dorsal reflex, plantar reflex. Okay, I'm gonna have you sit down for the strength. Full range of motion for lower extremities. Can you push my hand up? And then down, up, down, okay, up, down, up, down. Can you abdomen?
Out.
Yeah, out. And then in, out, in. Okay, can you push my hand up? And then pull it down. Okay, 5 out of 5 for muscle strength. Hand hygiene, do you have any questions for me?
When's lunch?
First, we're going to start with a simple eye exam. If you'll just look right over my shoulder. Okay, good. And if you will follow the tip of my pen with just your eyes.
Okay.
Okay, good. Next, I'm going to be checking your ears, your nose, and your mouth, okay?
Okay.
Can you pull your mask down for me? And say, ah. Okay, good. Everything looks pink and moist as it should.
Okay.
Next, I'm going to palpate your lymph nodes. Let me know if you have any discomfort or tenderness, okay?
Okay.
Any tenderness?
No.
Okay, good. I'm going to check your skin turgor.
Okay.
Immediate. Now I'm going to check your skin temperature on your arms, your radial pulse, grip strength, and capillary refill, okay?
Okay.
Okay, good. Let's check your capillary refill. If you'll put your hands up.
Okay.
Good, and turn them over. Check your radial pulse. Good, and now grip strength. Can you squeeze my hands? Pull and push?
Sorry.
It's okay. Okay, good. Now I'm going to do a respiratory assessment. I'm going to be looking at the rate and rhythm, your respiratory expansion, the use of any accessory muscles, your costal angle, and your rib slope, okay?
Okay.
So I'm going to check your costal angle first. You'll take a deep breath for me. Okay, good. I'm going to be listening to your lungs. If every time my stethoscope touches, if you'll take a deep breath for me, okay?
Okay.
Vesicular. Bronchovesicular. And vesicular. How about displace your breast, okay?
Okay.
Okay, good. Now if you'll turn around for me, we're going to do the same thing on your back.
Okay.
I'm going to assess your spine, the symmetry of your scapula, and your rib slope.
Okay.
So your spine is good and in line. We'll check your scapula. Can you shrug your shoulders and pull them back towards me? Good. Even. And now I'm going to check your rib slope. Take a deep breath for me. Okay, good. Now the same on the back as we did on the front. If every time my stethoscope touches, if you'll take a deep breath for me.
Okay.
Vesicular. Bronchovesicular. chair around for me. Everything sounds good. Now I'm going to listen to your heart sounds.
Okay.
Have you ever been told that you have a murmur?
No.
Okay. If you'll just relax for me, I'm just going to listen.
Okay.
Aortic, pulmonic, second pulmonic, tricuspid. I'm going to displace your breast.
Okay.
Mitral and epigastric. Okay, good. I'm going to listen one more time.
Okay.
Aortic, pulmonic, second pulmonic, tricuspid, mitral, and epigastric. Okay, good. Everything sounds good.
Okay.
Now I'm going to do an abdominal assessment. When was your last bowel movement?
This morning.
Okay, do you have any trouble with your bowel movements or urination?
I don't.
Okay, good. If you'll just lay back for me, I'm going to listen to your bowel sounds, and then I'm going to palpate for any tenderness, okay?
Okay.
Can you show me where your belly button is?
Right here.
Okay. Good. Now I'm just going to do some light palpations. You let me know if you feel any tenderness, okay? Any tenderness?
No.
Okay. All right, good. Now I'm going to be assessing your lower extremities. Okay, so first I'm going to do your skin temperature.
Okay.
Now I'm going to check your capillary refill, your pedal pulse. Okay, can you pull your feet towards you and push? Okay, good. Last thing I'm going to do is a sensation test. So if you don't mind, just close your eyes for me and just let me know where you feel me touching, okay?
Okay. Right upper arm. My right hand. My left upper leg. My right lower leg. My left foot.
Okay, perfect. You can sit up.
Okay.
Okay, everything looks good. I will let the doctor know and we'll get your paperwork. Do you have any questions for me?
I don't.
Okay, well, thank you, Reagan.
Thank you.
Have a good day.
You too.
Assess the skin. When you're assessing the skin, you're assessing for skin color, any lesions, any color lesions or abnormalities. A patient's skin is within normal limits for their ethnicity. And now I will assess for skin temperature with the back of my hand. And this temperature is warm to the touch, which is normal. Now I will also check for skin turgor. The best place to do this is in the clavicle, but you can also do it in the back of the hand and the forehead. Turgor is immediate, which is normal. Now we'll assess the nails. You're assessing for shape and color. Shape is good. Color is within normal limits. There are no abnormalities, no lesions, and no clubbing present. I will also assess the capillary refill. You do this by pressing onto the fingernail. Capillary refill is less than 3 seconds, which is normal. Now I will assess the head and the neck area. So when you're assessing for the head, you're assessing for shape, symmetry. Patient's head is symmetrical and normocephalic. Now I will palpate the scalp, and that is smooth, symmetrical, and normal. Now I will assess the first cranial nerve, which is cranial nerve number 7, and that is the facial nerve. And can you smile for me? Can you frown? Can you show your teeth, puff out your cheeks, raise your eyebrows, and close your eyes tightly? Patients did that with ease. Cranial nerve number 7 is intact. I take a breath for just a second. Okay, now we'll assess cranial nerve number 5, which is trigeminal. Can you clench your jaw? Kind of assess for tenderness in the masseter and up to the temporal. Now I'll also assess for their dull and sharp pain. I'm going to grab my tool. Can you please close your eyes for me and tell me if when you feel it, if it's dull or sharp?
Dull. Sharp.
Perfect. Cranial nerve number 5 is intact. Now I'm going to inspect the neck. Neck is symmetrical, no protrusions, no abnormalities, no tenderness is present, no swelling or redness. Now I'll palpate the lymph nodes. Okay, and that is going to be the occipital, postauricular, preauricular, tonsillar, submandibular, submental, deep cervical, and posterior cervical. And then you also assess the supraclavicular lymph node. And while you're doing this, you can also assess for cranial nerve number 11 by having the patient shrug their shoulders. Can you shrug your shoulders, please? Perfect. Cranial nerve number 11 is intact. Now I will assess the trachea by palpating it. Trachea is midline. Now I will check for jugular vein distension. I'm going to go ahead and grab my tool for this and have the patient go lay down. When you're checking for jugular vein distension, you want to make sure the patient is at least a 30 to 45 degree angle. You'll have them look to the side and you shine your pen light, just checking for any pulsations. Okay, that is good. Jugular vein does not seem distended. Can you go please sit back down for me? Okay, now we'll assess the eyes, and when you're doing this, you assess for cranial nerve number 2. That tests for visual acuity, which I had done that with the Snellen chart, and the patient's vision was 20/20, so cranial nerve number 2 is intact. Okay, now we'll observe the eyes for position and alignment. I'm going to also go ahead and grab my tool for this, so I will use it here in a little bit. So eye positions are within normal limits, no protrusion, no sinking is present. Now we'll palpate the lacrimal apparatus. No tenderness, no drainage or swelling. Now I'm going to observe the sclera and the conjunctiva. Can you look up for me? Okay, sclera of the eyes is white, conjunctiva is clear, moist, and smooth. Now I'm going to check for direct pupillary response to direct light. Pupil constricts normally. Now I will assess for indirect light. Pupils constrict normally. Now I will assess for accommodation and conversions by having the patient look out at a far object and focusing on my pen light. Can you look out to this object for me, please? Okay, perfect. And then can you look at it now? Now we'll assess cranial nerves number 3, 4, and 6 using the 6 fields of gaze. Can you follow my pen light? Okay, by doing this, she followed it easily. Cranial nerves number 3, 4, and 6 are intact. Now I'm going to be assessing the ears. When you're assessing the ears, you're checking for symmetry, color, any abnormalities. Patient's ears are symmetric, no abnormalities, no redness or discoloration. Now we'll inspect the auricle by pulling down. Auricle responds quickly with no redness or swelling. Now I'll inspect the tragus by pushing in. No tenderness is present. Now we'll inspect the lobes of the ears. Lobes are even, no redness or swelling present. Now we'll inspect the auditory canal. I'm going to go ahead and grab my otoscope for this. And when you're inspecting the auditory canal, you're looking for a pearly gray color. Okay, pearly gray is present, and no discharge present either. Okay, now we will be assessing for cranial nerve number 8, and this you do by doing the whisper test, Weber test, and rhyme test. So when you're doing the whisper test, you want to have the patient cover up one ear and whisper a word and have them repeat it back. Can you do your other ear for me?
Apple.
Perfect. Now I will need to grab my tuning fork to do the Weber test. And so when you do the Weber test, you want to have the patient, you want to strike this, and then you want to hold it on top of the head and ask the patient if they hear it in either one side or both sides. Okay, tell me if you hear it in both or one side.
Both.
Perfect. And then for the rhyme test, you're going to be checking for bone conduction and air conduction. So when I push this on your mastoid process, let me know when you can no longer hear it. Okay, and then now let me know when you can no longer hear it. Okay, rhyme test is negative because air conduction was 2 times longer than bone conduction. So cranial nerve number 8 is intact. Okay. Now we're going to check for the nose and the sinuses. So you want to inspect the nose for color and symmetry. I'm also going to go ahead and grab my pen light for this. Excuse me. Okay, color is even, smooth, no protrusions, no redness or swelling present. Now I'm going to check the sinuses by pushing in on the near the nose and above the eyebrows. No tenderness or swelling present. Now we'll inspect the patency by having the patient look up. Perfect. Patency is normal, no discharge present. I'll go ahead and put my pen light down for just a second. Now we'll assess the cranial nerve number 1, which is the olfactory. Now when you do this, you want to have the patient close their eyes and smell an item and identify that item. Can you please close your nose for me? Or close your eyes, I'm sorry. Okay, and what do you smell?
Coffee.
Perfect. Cranial nerve number 1 is intact. Okay. So now we are going to inspect the mouth and the throat. And you're going to inspect the lips, and you're checking for color. Color is normal to the ethnicity, smooth, no crack or dry. Now can you show me your teeth? Perfect. Colors within normal limits, no decay. And can you show me your gums? I need to get my pen light for this as well. Perfect. Gums are normal, no discoloration or redness or swelling present. Okay, now we'll check the tongue. Going to check for cranial nerve number 10, and then you have the patient press against the tongue depressor to assess for strength of the tongue. Perfect. Perfect. Cranial nerve number 10 is intact. Now I will assess cranial nerve number 12. Okay, and can you... I apologize. Let me go back and redo that. Okay, so cranial nerve number 10 is actually by having the patient have them open their mouth and say, oh, vagus is midline. Now I am assessing for cranial nerve number 12. And that's when you have the patient press their tongue against the tongue depressor to test for strength. Okay, perfect. Perfect. Now I'm going to also assess for cranial nerve number 9 and then have the patient swallow and you feel for any abnormalities. Perfect. Cranial nerves number 9, 10, and 12 are intact. Now I'm going to be assessing the arms, hands, and the fingers. Okay, and that's when I will check the radial pulses. You check them bilaterally.